This is Dr. Carol Heinrich, and we're going to be going over the presentation for Learning Module 1. This is the overview of gerontological nursing, and it's the first section for Module 1. The first few slides are going to be going over the history of gerontological nursing, and you can see as far back as 1966, which is a good 50 plus years ago, that the American Nurses Association first realized that the nursing care that's provided to older adults varies from the other age groups of patients that we see in healthcare settings. Again, especially the assessment, the interventions, as well as the evaluating to see if the care that is provided is effective is slightly different than the care that's provided for the other age groups of patients. 1989, a certification was established by the American Nurses Association for a gerontological clinical nurse specialist. This was another step in the right direction to have gerontological nursing as a special area within nursing. All right, standards of practice are the expected care that's being provided for any special group of patients. Again, there's critical care standards of practice. There's medical surgical nursing standards of practice. There is standards of practice for the emergency department. Professional nursing organizations collect evidence from the literature, and then they design and develop these standards of care. This is the best practices for the group of older adults in this situation. So back in 2010, again, the American Nurses Association was taking the lead, and they identified the scope of practice for gerontological nursing as well as standards of care. So again, these are the best expected practices for providing care for older adults. There are a few different nursing roles within gerontological nursing. As you can see, the first one is the generalist registered nurse. This person practices in a wide variety of clinical practice settings. Again, as you are in this course, you're registered nurses, and again, I could probably safely say that the majority of you have provided a lot of care, nursing care, for older adults. It could be in the emergency department, critical care, medical surgical units, home health services, it could be long-term care, it could be in physicians' offices and clinic settings. So again, the generalist registered nurse does provide care for older adults. And that highlights the need for a course similar to this. Then there's the advanced practice nursing role, like a nurse practitioner, clinical nurse specialist. Again, these are governed by the state board of nursing regulations, so it varies from one state to another. So again, for most states, the nurse practitioner is a provider of care with prescriptive privileges. It can be in a variety of the clinical practice settings. It could be acute care as well, it could be primary care. Then you have the clinical nurse specialist, who is also master's prepared, and they are functioning more as a staff educator of nurses or ancillary employees. It could also be a consultant on the care and being called in to evaluate the care of older adults. Again, there's patient-centered teaching, and again, they use a lot of evidence in getting their practice care standards up to the expected level by the standards of care that we talked about a few minutes ago. Again, there's talk now within nursing that, again, the master's level is being moved up to a doctorate of nursing practice. And again, you probably have heard a lot of that if you're looking into moving and continuing education to an advanced practice role. But that's not what we're talking about today. This is some of the terminology that you will see. Your book gives really good definitions. Again, very controversial as to who should be using what, so you're using all of these words being used. But again, the main thing that I'm going to address here is because our textbook is called Gerontologic Nursing. I'm always more familiar with gerontological nursing, so that's the frame of reference I'm going to be using in this course. Now we're going to be talking about the demographics of the older adult population. And we will